Hi, and welcome back to Palliative Care. I hope you had a bit of fun with that last little activity that you had to do, if you've done it. So, now as we carry on, we're going to have a look at a person's holistic needs and what it means in the palliative care setting. So, it focuses on healing the whole person, and it's not just about the person's physical needs, it's about all their needs. We're not just focusing on what the person's illness is, and it's understanding the interrelatedness between the mental, emotional, spiritual, physical, and the relational aspects of a person and their connection with culture and environmental influences. So this is based on Te Whare Tapa Whā, and it's looking at if the person has, say, something emotional going on, it can increase the physical symptoms, and it's about letting them have a connection with their culture as well. And I'm not just talking about um, their culture of being sick, it's about connecting their connection with their ethnicity, their beliefs, their religion, and all that sort of thing, things that are important to them. And having the knowledge that the mental, emotional, spiritual, and physical are connected to the cultural for that person. And also, the environment is not about the birds and the bees and the flowers and the trees. It's about what's going on around the person and how the person is connected to their environment in which they're in at the time, whether it be in their own home, whether it be in a residential care setting, or whether it be in a hospice care. And it's about making sure that all of those aspects are all connected together for the person, and it's not just the illness. And it's about connecting or discovering the person's own perceptions of his or her needs or wants. They need to be able to tell you what they need and what they want, and what their perception of what that means for them, because you might have two patients that have the same wants and needs, but their perception of that want or need is completely different. So they say to you, well, I want my religious um, pastor to be here, you know, um, to help look after my family as I'm passing away. Well, that could mean for one person that it's from the Catholic Church, and another one could be from the Muslim Church. So it's about you discovering what it is they want and not just guessing at it. Okay, and it's emphasizing the person rather than the disease or the illness. So it's about looking at the person's whole care and incorporating te whare tapa whā, the mental, emotional, spiritual, and physical, as well as their cultural and environmental aspects into their care, and emphasizing that rather than just looking at the illness or the disease that they've got, because they are more than just that. They are a person. Right, so you've got a holistic model of care. So it highlights the links between the physical, spiritual, environmental, individual, and importantly, the family side of the care. So you've got your physical care, your spiritual care in here, you've got your physical care here, your psychological care here, and you've got your social care here. And as you see, they're all interlinked and they all overlap each other. And if you're looking after somebody, you need to make sure that you're sitting in the middle here, where all of these aspects are encompassed. So if you are looking after their physical needs, then you need to make sure that you're also looking after their psychological needs. Because if someone is psychologically distressed, it can enhance the physical symptoms that they're actually having, which can then impact on their spiritual. Why is this happening to me? What have I done wrong? And then they could start pushing away the people that are important to them, like their family, like their friends, and you'll disconnect from the social aspects. Te whare tapa whā. So you've got your physical, spiritual, family, and mental health within this. So it references the body and is the physical manifestation of wellness. So it's about looking after the physical needs of the person. And the spiritual looks after the spiritual elements, family looks after the family, and making sure that the family is well looked after and um, that they are an important part of what's going on for the person. Okay, the mental relates to the importance of the mind and its ability to communicate, think, and feel emotion. So you've really got to look after someone's mental health. Now, it's very common that people that are coming towards the end of life or have been diagnosed with a life limiting illness, that depression could very well set in. So you need to watch out for things like that. Is the person pushing their family members away? Are they no longer enjoying the things that they used to enjoy? They're all aspects that you need to look at. So then you've got the concept of total pain. Okay, was developed by Dame Cicely Saunders, and she was the founder of the hospice movement. And it recognizes that pain is not just an expression of the physical effects of the disease or body. It is the pain that encompasses all of the person's physical, psychological, social, spiritual, and practical struggles. So, again, you've got pain in the middle, but if you look after the person's physical needs, you'll find that their psychological needs won't be as much either. If you look after their social needs, it could very well help their physical needs. And then you've got the spiritual needs. And if you look after the spiritual needs, the psychological needs may not be as much. They're just um, some examples of how the total pain model looks and what it is. So it's not about having the person in total pain, it's about looking after one thing to help everything. And the reason that we look at pain is because it's one of the most um, important aspects of the dying process for the patient and their family. So, and as it says here, holistic care considers all sources of palliative care patients' pain and needs. Right, the holistic care of dying. It's a circular process, so it doesn't stop at all. So there is no beginning and there is no end. Ongoing assessment and evaluation of care needs as the end of life stage progresses. So it's about assessing your patient all the time. And when someone is at the end of their life, their needs could change from day to day and then hour to hour. So you need to be assessing your patient all the time. You need to be providing a therapeutic care plan with a range of interventions that offer comfort and support. So it's not just about looking after the person's physical needs, it's about providing comfort and support. And having a therapeutic care plan isn't about getting a physiotherapist in or things like that. It's about what the person needs and what they want, emphasizing being with the patient and their family in the moment rather than doing. So it's not about task orientation. Sure, there are things that you do need to get done, but it's about being there. And it's about living in the moment with that patient and with their family. It's not just about, you know, showering them and doing all that sort of thing. It's about being there with them, talking with them, caring for them, respectful of the holistic needs and final wishes of the client and their family. We'll look at this a little bit further, a little bit deeper, a little bit further on. But it's about what the person wants. And it's not just about, again, the illness. It's about things like when they're in their dying phase, when they're actively dying, which is usually in the last 48 to 72 hours of life, what do they want? Do they want music playing? Who do they want there? Who don't they want there? Where do they want to be? What bed covers do they want on the bed? Things like that. So, we've got another activity here, applying the principles of palliative care. Okay? So this is where you need to develop a poster. We've been added, the scenario has been added onto. So the next bit of the scenario is 9 months later, Mrs. S's condition has deteriorated. With the support of her family, she wishes to remain in her home to receive end of life care. Okay, so we're not going to be working in groups, you're going to be working on your own. Consider the holistic needs of Mrs. S and her family that would support quality of life and quality of dying at the end of stage care. So, what sort of needs do you think she would have? You need to develop a poster to demonstrate the application of key aspects of holistic end of life care for Mrs. S and her family. And then you can upload that poster to the Moodle Dropbox. So I'll give you some examples. Um, so she wants to stay in her own home to receive end of life care. That's fine. What sort of equipment might you need to go in there to be put into the home to look after Mrs. S properly? And what sort of stuff does she want around her? What does she want you to do? And she's at the end of her life. Does she want the bed in the lounge? Does she want it in the bedroom? All those sorts of things. How often does she want her family to visit? You know, and you need to also encompass things that you think the family might need. So if you put that on a poster and you upload it to the Moodle Dropbox that's in palliative care, that would be great. So now we're going to have a look at Te Ara Whakapiri. It was introduced by the Ministry of Health in 2017, and it's a guideline for the last days of life. Now, there is a link on Moodle to this document. It is a very large document. Okay, it has got a lot of information in it, everything you would need to know to effectively look after a person at the end of their life. A pathway to inform best practice when delivering palliative and end of life care, and it's all based on a New Zealand perspective. So it comes out of New Zealand. We used to use the Liverpool Care Pathway Plan, and it wasn't culturally sensitive enough for the different cultures that live within New Zealand. So developed Te Ara Whakapiri. So what are the key principles? So, one of the key principles is the provision of person centered and dignified care. Now, person centered goes hand in hand with holistic. It's about what the person wants, what they need, and it's about keeping them dignified, not um, putting them into a situation that they don't want to be in. So if they decide that they want their bed in the bedroom because there's too many people in the house, then that's what you do. Okay, so and keeping them, yeah, just being respectful of the person, using clear and compassionate communication. Don't get grumpy. If you're having a bad day, you need to leave it at the door because a person can clearly pick up the fact that you're not having a good day. You need to be compassionate and your communication needs to be very clear in what you're saying. Don't beat around the bush. Don't make it fluffy, but be compassionate in what you're saying. You're all compassionate people. That's why you're doing this. You need to pay special attention to their cultural and spiritual needs, as we've already talked about. And it's all a part of this the person centered care, holistic care. Attention to detail on symptom management. So it's about being able to report for you as healthcare assistants. About being able to report that there is something wrong, that the patient's condition has changed, that, something needs to be done. The person's now in pain or they're breathing a bit differently. Okay. Supporting the family and whānau, that's really important. So you need to, because this isn't just at the dying stage. This is also really important after the person has died. Okay, so it's about supporting the family and whānau right the way through. It's not just about the patient. And it's about care after death. What does the person want after they die? How are you going to look after the person once they have died? Okay. Who's going to do what after the person has died? So, the components of care. Te Ara Whakapiri outlines a process of care that ensures the patient's the needs are being met at each stage of the end of life period of care to maintain comfort, support, and quality of dying that continues after death for the family. A comprehensive baseline assessment. So, when you receive a patient, they've had or should have a really comprehensive baseline assessment of what they're like when you first get them. Assesses the needs and prioritizes the individual. So it's not a tick box exercise. Sure, you need their baseline vital signs and observations and things like that, but you also need other baseline information and making sure that you're assessing the person all the time. And you, as healthcare assistants, can help in this aspect. And it's about making sure that if something has changed for the patient, that you report it, that you write it down, because as we know, if it's not written down, it was never done. So you need to keep assessing your patient, even if you're sitting there talking to them and you notice that today they're finding it a bit harder to talk to you than what they were yesterday. That needs to be noted. After death care includes verification of death and recognises the need of the family for information and support. So, you need to get someone to verify the death to start off with, and you, as healthcare assistants, can't do that. And you need to make sure that the family are supported and that any information that they need after death is given to them. If you can't give it to them, that you find somebody that can. It's really important that that after death care is given. Okay, so each of these is addressed from the perspective of the person who is dying and their family. So it not only is looked at from the perspective of the person, it's looked at from the family as well, as we know. Now, don't forget about consent. The person who is dying is your patient. you need their consent to involve their family. The health professionals providing care. So what they you might be asked questions. So as a health practitioner, you need to be able to answer some of these questions. And if you can't, don't try. Just say, I will find out for you, make a note of it, and try and get the information. The specific clinical service or healthcare organisation. So, whatever service they are under or the healthcare organisation that you work for, it comes from the perspective of them as well, although it's not as important. And the wider healthcare system. So, you've got to make sure that the expectations of the person that's dying and their family are realistic within the wider healthcare system. And if they're not, then quite possibly it can't happen. Okay. So, continuing with the scenario. Right. This is a carry on from your poster. So don't upload your poster until you've done this bit. Continuing with the scenario, select one of the principles of Te Ara Whakapiri and discuss, not as a group, as an individual, how you as an HCA could apply this in your care of Mrs. S and her family. So one of the principles, you need to go and have a look at the principles. Take a second principle and discuss what that would mean for client and family receiving quality palliative and end of life care in New Zealand. So then look at a second principle and write into your poster or bullet point into your poster what that would mean in providing quality palliative care and end of life care in New Zealand. Then consider the holistic needs of what support quality of life needs of that. That doesn't make sense. Consider the holistic needs that would support quality of life and quality of dying in the end of life care. Okay, so you need to put in there the holistic needs that would support quality of life and quality of dying in the end stage of care. So, what holistic needs would you have at the end stage of care? Okay, and then you need to upload your poster. It doesn't have to be flash, just a poster. Okay, right, so that's the end of session 2, and we will be back soon with session 3.